Have you been told you need to stop doing what you love, whether it's exercise, running, or a sport? Well, here at Dynamic, we don't like that answer. In this podcast, we'll talk to leaders in the health and wellness space from Southwest Florida to get the solutions you need to get you back to doing what you love. Welcome to the Dynamic Naples Podcast. What's going on, Naples? Today, I want to talk about the full systems approach, what that means, and give an example of why I chose to go the route that I did. As many of you may know, I don't bill insurance. There's a distinct advantage there in that I can treat the whole body and not just focus on one joint. I was talking today with a fellow physio and one of my best friends, Scott McNulty of Naples Sport and Spine Therapy, NSStherapy.com. By the way, he's a total badass when it comes to the spine, so if you have spine issues, definitely look him up. Anyways, we were talking about this whole model and how it's so much better to be able to treat the full body because of a case I had recently. I'm treating a gentleman he's a golfer. He's got some shoulder pain, and I looked at his shoulder. It looked like it's doing pretty well, but then I looked into his range of motion in his spine and in his hips. So there's something I call total rotation. So golf is a sport where you're standing with your feet planted, facing one direction, and then you got to rotate 90 degrees to your left if you're a right-hand golfer. All right. So that means roughly half of that comes from your hip rotation, and half of that comes from your spine rotation. There's a little bit of ankle rotation and stuff too, but that's pretty negligible compared to hip and spine. So I'm looking to see, how much hip internal rotation you have on your lead hip. So when you're golfing to the left, you're swinging right-handed, and your torso turns left. Your torso has to pivot on your femur, on a fixed femur, and that is internal rotation. If you think about your femur, it's going to be basically spiraling inwards, or your torso spiraling outwards on top of that femur. That's internal rotation of the hip. So you need about 45 degrees of that motion. And then your spine has to rotate another 45 degrees. So what I do is I look up those two, I measure those two ranges of motions, add them together. If it's less than 90 degrees total, then you're probably going to be finding extra movement somehow. Your body's going to get the task done. That's how sports are. That's why sports can cause injury, because you're not thinking about, I need to turn this way 45 degrees and this way 45. You're just trying to swing. And probably too hard usually. So the body finds what it needs somehow. So it'll just go up and down the kinetic chain to find the range of motion required before the movement. And in this case, what happens most often is that your hip runs out of range of motion, then your spine runs out of range of motion, and then the next joint it's going to take it from will be your shoulder. So now maybe you have normal range of motion in your shoulder, but now you're asking the shoulder to go past its physiologic norm. Whenever you push a joint past its normal end range, it's not going to feel good. I mean, that's, if you look at jiu-jitsu and the kimura, that's taking a shoulder and putting it into internal rotation. And then once you get to its end range of internal rotation, all you have to do is push a little further, and that person's going to tap out. Well, that's basically what you're doing to your shoulder if you're missing full range of motion rotation of the hip and spine as a golfer. If you were to bend a finger backwards, there's a certain point where you hit resistance. That's your normal end range of motion for bending your finger backwards. If you keep pushing into it, it's not going to feel good. And that, by the way, that goes into some of the pain science I've been talking about lately. The brain will basically start to give you a warning signal, hey, this hurts, stop doing that. But if you ignore that and push past that, you're going to rupture something, a muscle or a ligament. That's how it works. Again, pain always precedes actual injury. And this is the same thing. So if you're golfing and your shoulder is bothering you and you keep ignoring it, well, you're probably going to tear your rotator cuff, unfortunately. So pay attention to those warning signs. Anyways, in this particular patient of mine, his shoulder, he had normal range of motion, but it was bothering him. So I fixed his rotation in his spine and the rotation in his hip, and that was it. I took care of his shoulder. Shoulder pain went away. He did have to, take a few days off of golf, but then as soon as he got back with all that normal range of motion, he was able to golf pain-free. So how do you measure this on your own? So it just so happens if you look at your middle finger and your index finger and you spread them apart as far as you can, it happens to make a 45 degree, for most people, 45 degree angle. So you're going to use that as a measurement tool. What you want to do is sit upright on something where your feet don't touch the ground. All right, now put where your fingers meet, put that on top of your kneecap. All right, now take your index finger, point that straight down to the ground, and then move your leg, your shin, outward. As picture you're trying to shave the back of your calf. That's internal rotation of the hip. All right, so your shin goes out, and see if it falls in line with that 45 degree spread of your middle finger. If it's shy of that, then you know you're missing internal rotation of the hip. So that's how you assess the hip. Now the lumbar spine, this one's a little more tricky to describe, but sit down in a chair. All right, sit up with your back straight, so don't have your back on the rest. Cross your arms to your chest, and then keep your knees together. Now look straight ahead, and then think directly to your left is 90 degrees. Now find a spot in your vision that's a 45 from there. See if you can turn with keeping your knees together. Turn your belly button to that point that's 45 degrees from facing forward. And first of all, make sure you're upright. You're not side bending at all. Make sure you get pure rotation. And just notice, like, do you have freedom of movement, or do you have to struggle to get there? All right. So if you can't do both of those things, you know you're missing some range of motion in the hip and or the spine. And if you clear those things up, it might just take care of your shoulder. If you've got shoulder pain in golf and you've had it imaged and you found nothing wrong on the report, well, image is not going to show these types of limitations. It's not going to show a muscle being irritated. Imaging is only good for fractures, arthritis, tears, things of that nature, bursitis. It doesn't show a muscle that's irritated from being pushed past its physiologic end range. So if that sounds like you, try my self-tests. If they're too confusing to understand through a podcast, give me a call, 239-919-7139. Let's chat about it. I usually answer the phone. If I don't pick up, leave a message. That means I'm probably with a patient. And mention this podcast. Say, hey, I listened to your podcast on the shoulder when it pertains to golf. I'd like to talk about it because, I get a lot of spam calls. What's with all the spam these days? So definitely leave me a message. Okay, guys, that's it for this week. We'll talk to you soon. Do you have unexplained pain? Or do you wonder just how healthy you are? When was the last time you had your blood tested? Blood chemistry analysis is a great way to stay ahead of any health conditions. And now you can have control of your health with Let's Get Checked. Let's Get Checked is an incredible company that sends blood tests to your home. You can choose from over 30 different tests, whether that's liver function, testosterone, micronutrient, cholesterol, or C-reactive protein, which is a marker for inflammation. It's sent to you with free shipping, and you get results in 2 to 5 days, no physician referral needed. Use the code DPT20 for 20% off. Go to letsgetchecked.com and use the code DPT20. Did you know that you can get started with physical therapy without a physician's referral? Physical therapists don't just solve pain, we get down to the root cause and keep it from coming back. We also discuss all things health, such as nutrition and lifestyle changes. If you feel that you could use some help, let's get on a free consult call. Go to www.dynamicnaples.com and sign up for a free call. Also, if you like this podcast, please give us a rating wherever you listen to podcasts. It helps us spread the message. Thanks for listening, and we'll see you next week.